So someone was asking about the receptive speech and the expressive speech. Actually, let's talk about it. I'll share the whiteboard. And also the templates in development is very important. As we discussed, Mrcpch is very good for everything, but what happens during the exam, you cannot read long things. So for everything, there has to be a template. Especially the exam going in the last month, they should depend only on the templates. Okay. This is the Mrcpch. You can go through the development once or twice or thrice, no problem, but just make some important notes. But you should read from a book which has step-by-step explanation, like maybe Khidr Sheet or this Malaysia book, whatever, or even Abram is good. Abram also has step-by-step. Any one book you can read, or you can take a print and just go on adding points. One book is not sufficient. You have to add points from 2-3 books and make your own notes. This is the key for everything. But we have these templates which are helping. So regarding the expressive and receptive speech, he was talking the CV scope is the thing which we follow for the speech and hearing. So what is expressive here? Expressive is whatever the child can speak by the mouth and express himself is expressive. Receptive is what he can understand and follow your commands. Okay, first you have to understand what is expressive speech and what is receptive speech. Very important here. So expressive is what the child expresses himself, means opens and speak with you, is expressive. You give him a command and he follows your command. He is on the receiving side. You're giving him, he's receiving the command and following it. So he's receptive. So you all should know which are in the speech examination, which part will tell you whether it is expressive and which part will tell you whether it is receptive. Okay. So before continuing further, I want to be sure, am I audible and is everyone understanding me?
Yes.
Okay, great.
Yeah.
Now we will go to this scope. So CV is usually expressive because in CV, what do you say? Name, age, sex, that is gender of the child. You will ask what is your name, then what is your full name. Then you will ask what is your age and you are a boy or a girl. And then you have address, then you have birthday. So everything you ask, he has to speak up and answer to you. So my name is Mary or Mariam. And I am 3 years old. When she says Mariam, you will ask one more question. Tell me your full name. Then she should be able to say whatever is her full name, maybe Mariam Ahmad Khan or whatever. Okay. Then age, 3 years or but usually by 3 years they should be able to say the full name. Then name, age, sex, all these things by 3 years they have to tell. Address 4 years, birthday 5 years. So this is the expressive part of speech. Again, yes is for 3 things: sentences, song, stories. Obviously, sentences here they are talking about the speaking. The child should speak. Like how many words sentences he is able to. I drink tea. Okay. This is sentence with small 3 words, 3-word sentence. This is, or some children 2 years old, they will not say I will drink tea or I am drinking tea. They say just drink tea, like this. This is 2-word sentence. I am drinking tea. This is 3-word sentence, like this. So this is the sentence. Song is something they are singing, like twinkle twinkle little star, how I wonder what you are. All these things, if they're singing, this is a song which is expected by 3 years, and story is by 4 to 5 years. But again, this S part will come in your expressive. Okay, S part is expressive. Now C is what? For C you have counting and colors. Okay. I think there is some sound here. I want you to mute all your mics so that it becomes difficult for me. Okay, C is counting. You will ask him to count. Then they may count 1, 2, 3 and stop. Or some may go up to 5. Some may go up to 10. So counting 1 to 10. This is also expressive. And reverse counting 10 to 1. This can be done by 5 years. 10, 9, 8, 7, 6, 5. This is again expressive counting. Color is of two types. Some things is expressive, some things is receptive. Like asking the child, show me the red color. If he points you the color, this is receptive. Okay, which color is this? Red. He will say by the mouth. Then this is expressive. So you have to know the first. So categorize yourself. No, but as Dr. Tahir said, don't tell to the examiner everything that here I'm checking receptive, here I'm checking expressive. No need. Check as a whole, but in your mind you should know which is the receptive part you're checking, which is the expressive part you're checking. As I said, CV is receptive, expressive. Yes is expressive, and C, counting, is expressive. Color is something receptive, sometimes expressive, both. Okay, now we will go to O. O has what? Order commands. It is fully receptive. Order commands. One order, first order, second order, and third order commands. That means if you say just only take a doll, this is first order command. He'll just take a doll for you. Take a doll and give it to mommy. This is second order command. Take a doll, give it to mommy, then keep the duck on the table. This is third order command. Okay. All this is receptive. Just 1 minute. So order commands is usually fully receptive. Now we have P. P part also I have forgotten, but I will try to tell you. Plurals, okay, prepositions, plural prepositions, opposites, you will get. Okay, one thing is not, you can also add if you want comparatives here. Okay, so plurals usually like he, sorry, not he, I mean socks, trees. This is plurals. Means they should be able, usually it is receptive. If you tell the child, show me a tree, he will show. Now, can you show me trees? Means he has to show a group of trees in the book. This you will give him a book and ask. So this is the plural part. Usually it is receptive unless you ask him orally to tell what is this. If you ask him orally to say, then it becomes expressive. If you give him a book and ask him, show me the girls here, that means he should be able to show. This is plurals. Now preposition. You will give him something and ask him to keep it on the table. Then it is he is understanding the preposition. This is receptive. You will ask him to keep under the table. He is understanding to keep under the table. This is preposition. Okay. So what happened? Plurals, prepositions. Then comparatives. Comparatives is something you will give him a book and ask him, show me a tall boy. Show me, you will show two boys and ask him to show tall boy. He should pick this. Then you will show two ducks, maybe mother duck and baby duck. And then you will just ask, show me a small duck here. He should be able to show the small one like this. This is comparatives. Then opposites. Opposites is again asking, like showing a big rock and asking to show a small rock. They are almost same. Comparatives and opposites are almost same, but they should be able to tell you. Opposites is for a little bigger. Comparatives, like it will be side by side, they should be able to tell you. Opposites is something like you will show a big and ask him, can you tell me what is the opposite of this? Like this. It can be expressive also. So opposites is usually for the bigger children, like 5 years and more than 5 years. Comparatives is for 4 years. Prepositions is for 3 years and plurals is for 2 years. So you yourself have to decide. Sometimes, see, you will not be asked in every deaf speech and language evaluation to give a separate age for expressive and receptive. You will be asked only in the station or only in a case where you see a clear difference between expressive and receptive. Means if you have a child who is performing the receptive actions exactly as per his chronological age, but expressive, if you see, he's doing like a, for example, a 3 years old child, he is doing two order and three order commands also for you. This is receptive. But if you ask what is your name, he is able to tell only a part of the name, or only a small part of the name, not even complete name, not even age, not even gender. And if you ask to sing a song, he will not sing song, he'll just tell you 2 word sentences. Now there is discrepancy between receptive and expressive. In such a case, they will express you to tell them that I see that this child has a discrepancy in his receptive and expressive language. The receptive language is I will give 3 years old and he is going with the chronological age, but the expressive seems to be 2 years old, because and you have to give your explanation, because he's not able to tell his age, he's not able to tell whether he's a boy or a girl, and so on. But if you tell prepositions, he is able to understand. He's not able to sing a song, but he's able to follow 3 order commands. In that way, his receptive is good than expressive. This is expected only if there is discrepancy in the child. If the child doesn't have discrepancy between it, don't go to scratch your head about the difference and giving 2 separate ages. I hope it's clear. Is it clear for all?
Yes, ma'am.
Yes,
Yes,
please.
it's clear.
Yeah. Okay. That's it. So this was the only one thing. And regarding the video station, what Dr. Tahir was telling, yes, there is a video where it's a Kawasaki, but the rash is very faint. The same video was there in our exam also. But you should understand, the signs what were shown in the child head to toe was very clear. Like there was redness in the conjunctiva. It was just redness. We did not see any, they focused clearly on the eyes, and we did not see any discharges. And also the tongue was opened and shown, and the child was sitting on the mother's lap. The rash was very faint, but still, if most of the things are shown to you and the age is going, and also the opening statement is very important, you should concentrate on the opening statement. What was the statement given was, what this child is 4 years old or 3 years old, has prolonged fever. Prolonged fever means usually we all are worried for a fever more than 5 days. Okay, prolonged can be 4 days. Definitely it will not be 1 day or 2 day fever. It's a common sense. So prolonged should be either more than 5 days, or it can be 10 days, 15 days, whatever. This means prolonged fever, and they're focusing you everywhere. They're focusing on the eyes, they're focusing you on the tongue, they are focusing on the hands for you. There is some swelling in the hands, and there's a faint rash all over the body. It will strike you to the Kawasaki. The only thing is, whoever gives the exam before, you should contact them and know how are the videos and everything. Then only you'll understand. Suddenly you appear for an exam and you think that the video will be shown like a textbook case. It's very difficult. It will not be a textbook case. It will be like your normal practice, like atypical presentations can also come. And one video, this drop attacks, when it came for the first time, it was a sudden video, no one had before. It was first time drop attack video was there, and most of them got panic. But actually they were not expecting more. They just wanted to know the basic epilepsy management in that video. That's it. So basic is basic. If you know basic, you will pass this exam, but you need to practice. This is there. And I'm trying to help people in different ways. I keep posting the videos, though I cannot take the meetings, to do a meeting. I'll just stop. No need these things in the recording.
if there is no patient in the development station and just the role player like mother or father, we have to ask age-wise questions in social, hearing, um, fine motor, gross motor, that the child can do this and that.
No, actually, the development station goes like this. You will have a role player. Okay. So all the history part you will ask with the role player. History. Like when did you notice that this child has developmental delay? Okay. So you will start with it, and then your all pregnancy, prenatal, perinatal, postnatal, everything you will ask, family history, social history, everything regarding the developmental domains. The other question, suppose if your task is speech and language, if your task is speech and language, you will not ask about speech and language. Other gross motor, fine motor, and the what social, you will ask with the mother in the history only. Like suppose if the child is 3 years old, you will start, is the child able to run? If she's telling that if the child is able to run, khalas, she's 3 years old. It's okay, no need to go down. You can ask some upper question if she is not, like, can she go upstairs, downstairs, or something? They say no, 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 she can only run, or she can only jump. She can jump on place and also jump forward. So you understood that she's 3 years and she's appropriate, you can go forward. Like only two questions you will ask the mother. This is in the history. But when you come to speech and language examination part, the role player will go out. You will ask with the examiner, but before going to the speech and language assessment, you will do this general assessment, like 4Ds, what we talk. Is the child has distress? Is there any dysmorphism? But in the exam, you will not say dysmorphism. You'll say, is the child, you'll ask the examiner, does the child has any unusual features? Then about his dimensions, that is weight, height, head circumference also is very important in development station. If you ask head circumference and if he says large head, maybe this is hydrocephalus or something. So very important. Dimensions, weight, height, head circumference. After asking these basic questions, as the speech and language evaluation, everything you'll ask the examiner. Is the child, you will ask, I want to ask the name of the child. He will say, yes, she said Mariam. Can she tell me full name? If he says yes, she can tell full name. Her name is Mariam Ahmad Khan, like something. Okay, I will ask her, is she a boy or a girl? Is she able to say, yes, she said she's a girl, like this? He will answer you. Okay?
Who will assist from the examiner or the role player?
No, the answer for examination is from the examiner. Role player only history part.
Okay.
History is only by the role player. The examiner will give you the answers for the examination part. As soon as the history time finishes, the role player will go out of the room. You will be left with the examiner only. Okay, is it clear? Okay, so if there's no other questions, we'll end the meeting. Okay. Okay.
Thank you.
Okay, thank you all for attending, and